Senator Cardin.
Thank you, Mr. Chairman. Mr. Chairman, I am convinced that the fundamentals of the Affordable Care Act are sound. We've seen over the last 3 years the implementation in a very orderly way, protecting millions of Americans on better coverage and giving assurances that the practices that existed before the Affordable Care Act are being dealt with. And I think as my colleagues talk about the actions of private insurance companies today, go back before the passage of the Affordable Care Act and see how many people lost coverage, insurance companies pulling out of markets, reducing benefits, increasing premiums. We now have stability in the market, and that's due to the Affordable Care Act. And I also point out, in regards to the exchanges, the number of insurance carriers that are offering plans and the pricing of those plans came in much stronger than we anticipated when we passed the Affordable Care Act. So it's sound. I share the concern, I think, of every member of this committee, our disappointment as to how the website shopping and enrollment was not done more effectively starting October 1. And I guess my question, Madam Secretary, is that as a result of the delay of individuals being able to shop and enroll in the, on the websites on the internet, there are people who are going to be disadvantaged. We have people who have not gotten as far as they want. We're going to have consumer fatigue, people who will have a more challenging time. We also have a large number of people who have lost their coverage, which was understandable because this, as you've explained, these are policies that were changed since 2010. These are substandard policies. These are individuals who change their insurance policies frequently, but they want to enroll by mid-December so that they can get coverage effective January 1st. So my question to you is, what steps are you taking to deal with these individuals who have attempted but have not yet been able to enroll, and individuals who need coverage effective January 1st to make it easier and more convenient for people to be able to shop and enroll? It can be done on the internet, but it also can be done by paper and by telephone. What steps have you taken to protect those who may have suffered from delay in getting the website working?
Well, Senator, step number 1, 2, 3, 4, 5, 6 is really getting the site fixed as rapidly as possible. In the meantime, we are deploying additional assets. So the call center have additional individuals now. We have about 12,000 trained call center representatives who not only have an English and Spanish version of scripts, but translators who can answer questions in up to 150 languages, and they can take a consumer all the way from start to finish through the entire process, or just help a consumer create an application and they can go back to the site and visit it later. So that's very much underway, and we're trying to increase that visibility. Every community health center in America has outreach and enrollment trained workers on the ground throughout the country, and they are very actively working in their neighborhoods and their communities. Every state has a contract for community groups and well-known medical advocacy groups trained as navigators to walk people through. That can be done in a paper application or on the phone or in person.
I'm glad you mentioned paper applications, because you can do a paper application.
Yes, you can.
And I would just urge you to make that available for those who feel more comfortable using paper applications.
We always knew that there would be a portion of the population who would never use the web, who are not web savvy or don't have access or are not comfortable, so that we've always had alternate strategies. We're trying to actually enhance those alternate strategies.
Let me mention one other point, and that is the state exchanges, those that are being operated by the states, are having different results. Some are doing well, some are not. And I would just urge you to monitor the progress made on the state exchanges, because we want to make sure those who have been disadvantaged because of the inadequate performance on the online shopping and enrollment, that it may go beyond the federal exchanges and that those individuals are also protected as you look at ways to compensate for the slower rollout than we anticipated.
Senator, we have regular updates with the state directors. In fact, one is occurring at 4 o'clock this afternoon, so that we're not only trying to pay attention to marketplace with those 36 states, but also keeping in very close touch. Lessons learned, we'd like to deploy them in other areas, figure out what's working and what's not working, and use the full 6 months of open enrollment to really reach out and enroll people who are eager for affordable health care.